weeks or even months without fully resolving. Unlike typical acne that might be spread across the face, hormonal acne often appears in the same locations repeatedly. The hormonal pattern of acne is highly telling. Many women notice breakouts occur in a predictable pattern related to their menstrual cycle. Breakouts might appear 3 to 5 days before menstruation begins, resolve during menstruation, then reappear in the luteal phase, after ovulation. This cyclical pattern is a clear indicator of hormonal involvement. Some women break out only during specific phases of their cycle, while others experience breakouts throughout the cycle with worsening at predictable times. Hormonal acne results from heightened skin sensitivity to androgens, particularly testosterone and DHT, dihydrotestosterone. These male hormones stimulate sebaceous glands to produce more sebum, even in the presence of normal hormone levels. Additionally, androgens promote follicular hyperkeratinization and may increase colonization of acne-causing bacteria. Women's testosterone levels fluctuate with their menstrual cycle, with higher levels during the luteal phase, explaining the predictable timing of hormonal acne breakouts. Recognizing hormonal acne requires tracking your breakouts. Keep a calendar marking breakout dates and your menstrual cycle dates for 2 to 3 months. If breakouts cluster around specific menstrual cycle phases, hormonal acne is likely. Polycystic ovary syndrome, PCOS, a condition affecting ovulation and hormone regulation, often causes severe hormonal acne. Women with PCOS typically have elevated androgen levels and irregular menstrual cycles. Topical acne treatments alone are often insufficient for hormonal acne. While they help manage symptoms, they don't address the underlying hormonal cause. Therefore, treating hormonal acne often requires systemic, oral, medications that regulate hormones or reduce skin sensitivity to hormones. Hormonal contraceptives are the first-line treatment for hormonal acne in women who desire birth control. The hormones in birth control pills suppress ovulation and, importantly for acne, reduce circulating androgen levels. Specifically, oral contraceptives increase sex hormone-binding globulin, SHBG, a protein that binds androgens and makes them unavailable to skin cells. The result is reduced sebum production and decreased follicular keratinization. Not all birth control pills are equally effective for acne. Combination pills containing estrogen and progestin are effective. However, some progestins have androgenic properties, meaning they act similarly to testosterone, and can worsen acne. Progestins with lower or no androgenic activity include norgestimate, desogestrel, and drospirenone. Birth control pills specifically approved for acne treatment by the FDA include orthotricycline, norgestimate, estrostep, norethindrone, yaz, drospirenone, and bayaz, drospirenone with additional vitamins. These pills typically show acne improvement after 3 to 4 months of use, with maximum improvement by 6 months. Starting a new birth control pill doesn't immediately improve acne. Acne often temporarily worsens in the first 1 to 2 months as your body adjusts to new hormone levels. This temporary worsening isn't a sign the pill won't work, it's normal. Stick with your chosen pill for at least 3 months before concluding it isn't working. If after 3 months acne hasn't improved, discuss switching to a different progestin or a different pill formulation with your gynecologist or dermatologist. Spironolactone is an alternative or complementary treatment for hormonal acne. This medication is a potassium-sparing diuretic that also acts as an androgen receptor antagonist, blocking androgens from affecting skin cells. Spironolactone is typically used at doses of 50 to 100 mg daily for acne treatment. It's often prescribed in combination with birth control pills for additional effectiveness. Spironolactone requires careful monitoring. Potential side effects include dizziness, lightheadedness, menstrual irregularities, and breast tenderness. More serious but rare complications include elevated potassium levels that can affect heart rhythm. Regular blood tests monitoring kidney function and potassium levels are necessary when taking spironolactone. Despite these considerations, many dermatologists consider spironolactone an excellent option for hormonal acne, particularly when combined with topical treatments and possibly birth control pills. Lifestyle factors significantly impact hormonal acne. Stress increases cortisol production, which increases androgen activity and sebum production. Implementing stress reduction techniques like meditation, yoga, regular exercise, and adequate sleep improves hormonal balance and acne. Regular aerobic exercise appears particularly beneficial for hormonal regulation. Diet influences hormonal acne through multiple mechanisms. High glycemic foods spike blood sugar and insulin, stimulating sebaceous gland activity and androgen production. Reducing refined carbohydrates and sugar while increasing complex carbohydrates, fiber, and whole foods helps regulate blood sugar and improve acne. Some research suggests dairy products, particularly skim milk, may trigger acne through hormonal pathways. Reducing dairy or switching to hormone-free milk might help if dairy appears to worsen your acne. Insulin resistance, common in women with PCOS, worsens hormonal acne. Reducing refined carbohydrates and sugar, eating regular meals with balanced macronutrients, and maintaining healthy body weight improves insulin sensitivity and can significantly reduce acne. Adding inositol supplementation may help with insulin resistance in some women. Discuss this with your healthcare provider. When to consider professional treatment for hormonal acne. If your acne is severe, widespread, or causes significant psychological distress, see a dermatologist and gynecologist together. If topical treatments haven't adequately controlled your acne after 3 months of consistent use, discuss systemic treatment options. If you suspect hormonal imbalances, irregular periods, excessive hair growth, fertility issues, see both specialists. Guide 8. Natural and evidence-based home remedies for mild to moderate acne. While prescription and over-the-counter acne treatments are scientifically validated and highly effective, several natural ingredients have research supporting their acne-fighting properties. These natural remedies can supplement professional treatments or be used alone for mild acne. Understanding which natural ingredients are evidence-based versus marketing hype is crucial. Tea tree oil is one of the most researched natural acne remedies. Multiple studies demonstrate its antibacterial and anti-inflammatory properties. Tea tree oil kills acne-causing bacteria and reduces inflammation associated with pimples. However, undiluted tea tree oil is irritating and can cause contact dermatitis, redness, and dryness. Always dilute tea tree oil with a carrier oil like coconut oil, jojoba oil, or argan oil before applying to skin. A typical dilution is 5 to 10% tea tree oil mixed with carrier oil. Apply this diluted mixture as a spot treatment to individual pimples using a cotton swab. Don't apply to your entire face, as this may be overly drying. Aloe vera has well-documented anti-inflammatory and antimicrobial properties. Pure aloe vera gel, applied directly from the leaf or as a pure gel product, soothes inflamed acne, reduces redness, and promotes healing. Aloe vera doesn't have the side effects associated with many acne treatments. It won't dry your skin excessively or cause irritation. Apply pure aloe vera gel as a spot treatment or all over your face as a lightweight moisturizer. Most people tolerate aloe vera well, though some experience mild irritation. If you're allergic to plants in the Liliaceae family, lilies, onions, garlic, you might react to aloe. Honey, particularly raw and manuka honey, has antimicrobial, anti-inflammatory, and healing properties. Raw honey contains enzymes and compounds that fight bacteria and reduce inflammation. It's gentle and suitable even for sensitive skin. Apply raw honey as an occasional face mask. Mix a small amount with water to create a spreadable consistency. Apply to clean skin for 10 to 15 minutes, then rinse with lukewarm water. You can do this 1 to 2 times weekly. Some people apply honey directly to pimples as a spot treatment. Honey is gentle, affordable, and many people find it effective for mild acne. Green tea contains powerful antioxidants called catechins that have antibacterial, anti-inflammatory, and sebum-reducing properties. Studies demonstrate that topical green tea application reduces acne severity. Brew strong green tea, allow it to cool completely, and use it as a rinse after cleansing, as a toner, or apply it to your face with a cotton pad. Alternatively, use a face mask or moisturizer containing green tea extract. Many commercial skincare products now include green tea for its antioxidant benefits. Most people tolerate green tea topically well, though those with sensitive skin might experience mites. Manage this by stopping all actives temporarily and using only gentle cleanser, hydrating moisturizer, and sunscreen for 1 to 2 weeks. Allow your skin barrier to repair. Then gradually reintroduce treatments at lower concentrations and frequencies. Building tolerance to treatments requires patience and gradual progression. Start conservatively and increase gradually. This approach takes longer initially but leads to better long-term outcomes than aggressive starting that causes severe side effects and treatment discontinuation. Remember that slow, consistent progress is preferable to fast progress interrupted by side effects forcing you to quit. Guide 19: The Complete Long-Term Acne Maintenance and Prevention Plan. Once you've achieved clear skin, the challenge becomes maintaining clarity. Many people achieve clear skin only to abandon their routines, resulting in acne recurrence. Understanding long-term maintenance prevents this cycle and keeps your skin clear indefinitely. Continue your core routine indefinitely. The Cleanse, Treat, Moisturize, Protect routine that cleared your acne remains essential for maintaining clear skin. Don't abandon these steps thinking they're only necessary while acne is active. Your skin's tendencies haven't changed. Stopping treatment allows acne to return. Identify which specific treatments worked for you and continue them. If salicylic acid was crucial to your success, continue using it at maintenance levels, perhaps 2 to 3 times weekly instead of daily. If retinoids were essential, continue them nightly or at whatever frequency you use successfully. If benzoyl peroxide was key, continue it. Maintenance doesn't require the aggressive frequency you may have used during active acne treatment, but it requires continuing the treatments that worked. Simplify your routine for maintenance if desired. During active acne treatment, you might use multiple actives, but once clear, you can often maintain clarity with fewer products. For example, you might maintain clear skin using just retinoid at night and benzoyl peroxide spot treatments as needed, dropping the salicylic acid cleanser you used initially. Experiment to find the minimum effective routine for your skin. Monitor your skin monthly for early signs of breakout. Catching pimples at the very first sign and treating them aggressively prevents them from developing fully. Many people can prevent significant breakouts through early intervention with spot treatments when they notice the first small bumps. Keep your skincare routine on hand. Never run out of your essential treatments. Having spare bottles ensures you never skip treatments due to product unavailability. Some people order backup products when their current product is half empty, ensuring continuity. Identify your acne triggers through your skincare journal. Did acne worsen during stressful periods? After consuming certain foods? During certain times of your menstrual cycle? After skipping your routine? After trying new products? Understanding your personal triggers allows you to implement preventative strategies. If you identify stress as a trigger, prioritize stress management. If certain foods worsen acne, avoid them. If hormonal cycling causes breakouts, prepare in advance with more aggressive treatment during high-risk times. Seasonal adjustments may be necessary. Some people experience worse acne in summer, increased heat, humidity, sun exposure, or winter, dry air, heating systems. Adjust your routine seasonally, perhaps more frequent use of oil control treatments in summer, more aggressive moisturizing in winter. This flexibility maintains clear skin year-round. Maintain the lifestyle habits that support clear skin. Continue stress management, adequate sleep, regular exercise, healthy diet, and hydration. Don't revert to poor habits thinking your clear skin is permanent and won't be affected. Lifestyle factors remain important indefinitely. Schedule regular dermatology visits even after achieving clear skin. Annual checkups allow your dermatologist to assess your maintenance routine, adjust treatment if necessary, and catch any skin concerns early. Regular professional oversight prevents complications and ensures your long-term skin health. Handle occasional breakouts strategically. Everyone experiences occasional breakouts despite perfect routines, a particularly stressful period, new product irritation, or unknown trigger can cause isolated pimples. Treat these immediately with appropriate spot treatments. Don't allow occasional breakouts to discourage you into abandoning your routine. If you notice increasing breakouts despite consistent routine, assess what has changed. New products? Increased stress? Dietary changes? Hormonal changes? Identifying changes allows you to troubleshoot. Sometimes a simple adjustment, returning to a previous moisturizer, increasing stress management, or addressing dietary changes, restores clarity. For women, track your menstrual cycle and acne patterns indefinitely. If hormonal patterns are evident, you can prepare in advance during high-risk times with more aggressive treatment or preventative actions. Update your routine periodically based on new information. Skincare science evolves, new evidence-based ingredients and treatments emerge. While your core routine remains consistent, you might incorporate new additions. For example, if you weren't using sunscreen consistently but learn about new photostable sunscreen formulations, adding a good sunscreen enhances your results. However, Don't constantly change your routine chasing new trends. Consistency matters far more than having the newest products. Have a plan if major breakout recurs. If despite your best efforts you experience significant acne recurrence, don't panic or feel you've failed. Contact your dermatologist to identify what changed and resume professional treatment if necessary. Sometimes life circumstances, severe stress, hormonal changes, medications, require adjusting your treatment approach. Your dermatologist can help. Celebrate achieving clear skin. Reaching this point likely required significant effort and patience. Recognize the achievement and the work that got you there. This perspective helps maintain motivation for long-term maintenance. Guide 20. Integrating all components, your complete personalized acne treatment and maintenance blueprint. After understanding individual components of acne treatment, integrating them into a comprehensive, personalized blueprint is essential. No single treatment works for everyone. Your specific acne type, skin characteristics, and lifestyle factors should guide your approach. Step 1. Accurately identify your acne type. Do you have comedonal acne, blackheads and whiteheads? Inflammatory acne, red pimples? Hormonal acne, deep cystic lesions around your jawline during specific times? Severe acne involving all types? Your acne type guides treatment selection. Comedonal acne responds best to salicylic acid exfoliation. Inflammatory acne responds best to benzoyl peroxide. Hormonal acne often requires systemic hormonal treatment. Severe mixed acne usually requires combination treatments and potentially professional intervention. Step 2. Assess acne severity. Mild acne, fewer than 20 comedones, fewer than 15 inflammatory lesions, no nodulocystic lesions, often responds adequately to topical treatments alone. Moderate acne, 20 to 100 comedones, 15 to 50 inflammatory lesions, no nodulocystic lesions, typically requires combination topical treatments, possibly with professional treatments. Severe acne, extensive lesions, numerous nodulocystic lesions, usually requires systemic treatment including oral antibiotics, hormonal treatments, or potentially isotretinoin. Step 3. Consider your lifestyle factors. Are you comfortable with multiple daily skincare steps? Can you prioritize sleep and stress management? Will you maintain consistency? These practical factors determine whether complex multi-step routines are realistic for you. Some people thrive with detailed routines, others do better with simplified approaches. Step 4. Design your core routine. Everyone benefits from a consistent cleanse, treat, moisturize, protect routine. Select specific products for each step based on your acne type. For comedonal acne, use a gentle cleanser, apply salicylic acid treatment, use a non-comedogenic moisturizer, apply sunscreen. For inflammatory acne, use a gentle cleanser, apply benzoyl peroxide treatment, use a moisturizer, apply sunscreen. For mixed or severe acne, consider consulting a dermatologist for prescription treatments. Step 5. Start conservatively with treatments. Begin with a single. While actual isotretinoin-induced depression is rare, patients do report mood changes, and there's ongoing debate about causation versus correlation. Patients with personal or family history of depression should discuss this risk carefully with their dermatologist. Many dermatologists don't prescribe isotretinoin to patients with untreated depression or psychiatric conditions, or do so with additional psychiatric monitoring. Isotretinoin can cause temporary initial acne worsening, flaring, as sebaceous glands adjust and dead skin cells are shed. This flaring is temporary and can be managed with topical treatments or low-dose oral corticosteroids in severe cases. Muscle and joint pain occur in some patients, typically mild but sometimes bothersome. This side effect often improves with continued use or resolves after treatment stops. Who is an appropriate candidate for isotretinoin? Severe nodular acne with risk of scarring is the classic indication. Acne resistant to maximum dose oral antibiotics combined with topical retinoids for at least 3 to 4 months is another strong indication. Any acne causing significant psychological distress or affecting quality of life substantially is also appropriate. Recurrent acne after previous isotretinoin course might be retreated with isotretinoin, though some dermatologists reserve retreatment for specific circumstances. The process of obtaining isotretinoin involves consultation with a dermatologist willing to prescribe it, understanding all requirements and side effects, baseline laboratory testing, and enrollment in 𝑰𝒏𝒏𝒔𝒊𝒏𝒈. For women, establishing contraception plan is necessary. Once established on isotretinoin, compliance with monthly visits and laboratory tests is mandatory. Noncompliance results in treatment discontinuation. Cost is a consideration. Isotretinoin itself is relatively inexpensive. The original brand Accutane is expensive, but generic isotretinoin is affordable. However, the required monthly visits and laboratory tests add significant cost. Insurance typically covers isotretinoin for severe acne, but coverage varies. Discussing cost with your dermatologist before starting is important. Results from isotretinoin are remarkable. Most patients experience dramatic acne improvement within 1 to 2 months, with near-complete clearance by 3 to 4 months. The persistence of results years after treatment completion is what makes isotretinoin special. Most other treatments require ongoing use for results to persist. Post-isotretinoin skin care involves using gentle products, as skin is often more sensitive after treatment. Many patients can use minimal skin care after isotretinoin, though some benefit from occasional retinoid maintenance to prevent any acne recurrence. Most patients can essentially stop acne-focused skin care and use only basic skin care and sunscreen. Isotretinoin should not be your first treatment. Attempting appropriate topical treatments, salicylic acid, benzoyl peroxide, retinoids, and potentially oral antibiotics for several months should precede isotretinoin consideration. However, if you have severe acne causing scarring risk or significant distress, don't suffer for years without considering isotretinoin. Discuss it with your dermatologist if you have severe, resistant acne. Guide 22, Oral Antibiotics for Acne, Types, Mechanisms, Resistance, and Long-Term Management. Oral antibiotics have been acne treatment staples for decades, effectively controlling moderate to severe inflammatory acne. Understanding antibiotic options, their effectiveness, the critical issue of antibiotic resistance, and appropriate usage patterns is essential for optimal acne treatment. Oral antibiotics treat acne through multiple mechanisms. First, they kill Cutibacterium acnes bacteria, reducing bacterial colonization in follicles. Second, at acne-treating doses, they have significant anti-inflammatory effects beyond their antibacterial properties. Third, They can reduce lipase production, an enzyme that increases sebum irritancy, decreasing acne inflammation. The combination of these effects makes antibiotics highly effective for inflammatory acne. Doxycycline is the most commonly prescribed oral antibiotic for acne. It's effective, relatively inexpensive, and generally well tolerated. Typical dosing is 100 mg once or twice daily. Doxycycline has additional anti-inflammatory effects beyond its antibacterial action, partly explaining its effectiveness for acne. However, doxycycline has notable drawbacks. It can cause photosensitivity, sun sensitivity, so strict sunscreen use is essential during treatment. It can cause esophageal irritation if not taken properly, requiring taking it upright with significant water and not lying down for 30 minutes afterward. Some women experience vaginal yeast infections due to disruption of normal bacterial flora. Birth control pill effectiveness can be reduced by doxycycline in some individuals, requiring backup contraception. Minocycline is an alternative tetracycline antibiotic with similar effectiveness to doxycycline. It's lipophilic, fat-soluble, allowing it to penetrate sebaceous glands well. Minocycline can cause blue discoloration of skin and mucous membranes with long-term use. While this is reversible upon discontinuation, it's an undesirable potential side effect. Minocycline also has slightly higher risks of drug-induced lupus and autoimmune hepatitis compared to doxycycline, though these are rare. Many dermatologists now prefer doxycycline over minocycline due to these considerations. Azithromycin is a macrolide antibiotic sometimes used for acne. It's taken at lower doses than typical infection-treating doses, 250 mg 3 times weekly. Azithromycin has strong anti-inflammatory effects. However, Cutibacterium acnes resistance to azithromycin is increasingly common, making it less reliable than tetracyclines. Azithromycin is often reserved for patients who cannot tolerate tetracyclines. Trimethoprim sulfamethoxazole, TMPSMX, is a combination antibiotic occasionally used for acne, particularly in patients who cannot tolerate tetracyclines. However, it's less effective than tetracyclines and has higher allergy rates, limiting its use. Isotretinoin can cause temporary initial acne worsening, flaring, as sebaceous glands adjust and dead skin cells are shed. This flaring is temporary and can be managed with topical treatments or low-dose oral corticosteroids in severe cases. Muscle and joint pain occur in some patients, typically mild but sometimes bothersome. This side effect often improves with continued use or resolves after treatment stops. Who is an appropriate candidate for isotretinoin? Severe nodular acne with risk of scarring is the classic indication. Acne resistant to maximum dose oral antibiotics combined with topical retinoids for at least 3 to 4 months is another strong indication. Any acne causing significant psychological distress or affecting quality of life substantially is also appropriate. Recurrent acne after previous isotretinoin course might be retreated with isotretinoin, though some dermatologists reserve retreatment for specific circumstances. The process of obtaining isotretinoin involves consultation with a dermatologist willing to prescribe it, understanding all requirements and side effects, baseline laboratory testing, and enrollment in 𝑦𝒏𝒏𝒔𝒊𝒏𝒈. For women, establishing contraception plan is necessary. Once established on isotretinoin, compliance with monthly visits and laboratory tests is mandatory. Noncompliance results in treatment discontinuation. Cost is a consideration. Isotretinoin itself is relatively inexpensive. The original brand Accutane is expensive, but generic isotretinoin is affordable. However, the required monthly visits and laboratory tests add significant cost. Insurance typically covers isotretinoin for severe acne, but coverage varies. Discussing cost with your dermatologist before starting is important. Results from isotretinoin are remarkable. Most patients experience dramatic acne improvement within 1 to 2 months, with near-complete clearance by 3 to 4 months. The persistence of results years after treatment completion is what makes isotretinoin special. Most other treatments require ongoing use for results to persist. Post-isotretinoin skin care involves using gentle products, as skin is often more sensitive after treatment. Many patients can use minimal skin care after isotretinoin, though some benefit from occasional retinoid maintenance to prevent any acne recurrence. Most patients can essentially stop acne-focused skin care and use only basic skin care and sunscreen. Isotretinoin should not be your first treatment. Attempting appropriate topical treatments, salicylic acid, benzoyl peroxide, retinoids, and potentially oral antibiotics for several months should precede isotretinoin consideration. However, if you have severe acne causing scarring risk or significant distress, don't suffer for years without considering isotretinoin. Discuss it with your dermatologist if you have severe, resistant acne. Acne resistant to standard topical treatments, particularly if inflammatory and deep, often reflects hormonal causes. Women with other hormonal symptoms, irregular periods, excessive hair growth, hair loss, fertility issues, should definitely pursue hormonal evaluation. Primary hormone involved in acne is androgen, particularly testosterone and DHT, dihydrotestosterone. However, most women with hormonal acne have normal total testosterone levels but exhibit heightened skin sensitivity to androgens. This explains why some women with normal hormones still have significant hormonal acne. It's about skin sensitivity, not absolute hormone levels. Relevant hormonal tests for acne evaluation include total testosterone, free testosterone, calculated or direct measurement, DHT, dihydrotestosterone, DHAS, dehydroepiandrosterone sulfate, LH, luteinizing hormone, FSH, follicle-stimulating hormone, and androstenedione. These tests assess androgen status and ovulatory function. Additionally, tests for other hormones affecting acne include estradiol, progesterone, tested in luteal phase for ovulation confirmation, cortisol, for stress-related endocrine effects, and thyroid function, TSH, free T4, may be relevant. Ovulatory dysfunction, present in conditions like PCOS, contributes to hormonal acne. PCOS involves elevated androgen production, irregular ovulation, and insulin resistance. Women with PCOS typically have irregular periods, acne, hirsutism, excessive hair growth, androgenetic alopecia, pattern hair loss, and often obesity. Testing for PCOS is appropriate for women with these symptoms. PCOS diagnosis requires ovulatory dysfunction, irregular periods, plus hyperandrogenism, elevated androgens or clinical signs, and/or polycystic ovarian appearance on ultrasound. Baseline hormonal testing during the follicular phase, first 7 days of menstrual cycle, is standard because hormone levels are more stable and baseline during this phase. FSH and LH are assessed during the follicular phase. Progesterone is tested during the luteal phase, typically 7 to 8 days after ovulation, to confirm ovulation occurred. Testing hormone levels at the wrong cycle phase produces misleading results. Understanding test results requires expert interpretation because normal ranges vary widely, and what's normal for general population might indicate androgen excess relative to individual baseline. A testosterone of 50 ing/dL is normal for most women but might represent significant elevation for a particular individual. Free testosterone is often more clinically relevant than total testosterone because it represents the active hormone, though measuring free testosterone is technically challenging and prone to error. Elevated DHAS, particularly if greater than 350 μg/dL, suggests adrenal androgen excess and warrants further adrenal evaluation. Elevated androstenedione suggests adrenal or ovarian androgen production. Elevated LH with normal or low FSH suggests ovulatory dysfunction characteristic of 𝒂𝒄𝒆. If hormonal testing reveals significant androgen excess, additional testing might assess the source. Adrenal tumors or ovarian tumors very rarely cause acne but can cause very severe hyperandrogenism. Evaluating clinical presentation helps distinguish adrenal from ovarian sources. ACTH stimulation testing can differentiate adrenal from ovarian androgen excess if warranted. Interpreting results in clinical context is essential. You might have borderline elevated testosterone with classic hormonal acne, jawline breakouts, cyclical pattern, making hormonal treatment appropriate despite normal lab values. Conversely, you might have elevated testosterone labs without significant acne, making hormonal treatment unnecessary. Clinical presentation guides treatment more than isolated lab values. When to pursue hormonal evaluation: irregular or absent menstrual periods, acne with cyclical menstrual pattern, acne onset in adulthood, acne concentrated on jawline and lower face, acne resistant to standard treatments, signs of hyperandrogenism, hirsutism, hair loss, male pattern baldness, family history of 𝒂𝒄𝒆 or hormonal disorders, concerns about fertility. Other reasons to evaluate hormonal status. Additionally, pursuing evaluation before starting hormonal treatments gives baseline data to assess treatment effectiveness. Working with appropriate clinicians, gynecologists are ideal for hormonal evaluation in women, though some dermatologists also perform this evaluation. Reproductive endocrinologists specialize in hormonal disorders and are appropriate referrals for complex cases or 𝒂𝒄𝒆 evaluation. Family medicine physicians can perform initial evaluation. Choosing a clinician experienced in hormonal acne and 𝒂𝒄𝒆 improves evaluation quality. After hormonal evaluation, appropriate treatment depends on findings. If 𝒂𝒄𝒆 is confirmed, treatment includes hormonal contraceptives for acne and period regulation, spironolactone, antiandrogen, metformin for insulin resistance, and lifestyle modification. If adrenal androgen excess is identified, dexamethasone might be considered. If results are normal despite hormonal acne pattern, empirical hormonal treatment, oral contraceptive or spironolactone, remains appropriate despite normal labs. Timeline for hormonal treatment effectiveness is months, not weeks. Hormonal treatments typically require 3 to 6 months to show acne improvement, with maximal improvement often occurring after 6 to 12 months. Patience is necessary. Discontinuing hormonal treatment after 2 to 3 months before full benefits appear is a common mistake. Reassessment after hormonal treatment initiation is valuable. Repeating key hormonal tests, particularly free and total testosterone, after several months on hormonal treatment confirms that the treatment is achieving hormonal effects. If testosterone hasn't decreased despite hormonal treatment, investigating why, medication noncompliance, inadequate dosing, ineffective treatment choice, is appropriate. Guide 38, Dietary Supplements for Acne, Evidence-Based Review of Oral Supplements. Numerous dietary supplements are marketed for acne with varying levels of evidence. Understanding which supplements have evidence, realistic expectations for supplementation, and appropriate dosing guides inform decisions about supplementation. Zinc supplementation has evidence for acne improvement, particularly in individuals with zinc deficiency. Zinc supports immune function, wound healing, and inflammation reduction, all relevant to acne. Studies show that oral zinc at 30 to 50 mg daily improves acne moderately. However, excessive zinc supplementation, above 150 mg daily long-term, causes nausea and interferes with copper absorption. Typical zinc supplementation is 25 to 30 mg daily. Zinc is more effective for those with demonstrated zinc deficiency, though some people without deficiency also benefit. Blood zinc levels can be tested to assess zinc status, though zinc testing is not widely available. Vitamin D supplementation shows promise for acne. Vitamin D has immune and anti-inflammatory effects relevant to acne. Low vitamin D levels correlate with worse acne. Vitamin D supplementation at 1000 to 400 IU daily might improve acne, particularly in those with low baseline levels. However, evidence is mixed, and benefits are modest. Vitamin D supplementation is generally safe and supports overall health beyond acne, making it reasonable to consider. B vitamins, particularly B5, pantothenic acid, are promoted for acne. Pantothenic acid is marketed at very high doses, 10 grams daily, claimed to reduce sebum production. While some small studies suggest benefit, evidence is weak. High-dose pantothenic acid causes diarrhea frequently and benefits aren't reliably demonstrated. Supplementation is not recommended without stronger evidence. Omega-3 fatty acids, fish oil supplementation, support anti-inflammatory effects and improve acne in some individuals. Omega-3s reduce systemic inflammation and support skin health. Typical supplementation is 1 to 2 grams daily of combined EPA and DHA. Fish oil becomes thin, allows excessive water loss, and becomes reactive to previously tolerated products and environmental factors. Signs of barrier compromise include tightness and discomfort, increased dryness and flaking despite using moisturizer, redness or inflammation without active acne, stinging or burning when applying products previously tolerated, increased sensitivity to temperature extremes, and heightened reactivity to skin care products, developing reactions to products that previously seemed fine. Several factors compromise the skin barrier during acne treatment. Multiple chemical exfoliants, salicylic acid, glycolic acid, used simultaneously strip away protective lipids excessively. Retinoids, while beneficial, can compromise the barrier during the initial adaptation phase. Benzoyl peroxide can be somewhat drying. Hot water and harsh cleansing compromise the barrier. Excessive sun exposure damages barrier function. The cumulative effect of multiple treatments or very aggressive single treatments overwhelms the barrier's ability to maintain function. Barrier repair requires specific approaches different from standard acne skin care. The goal shifts from treating acne to restoring skin health. This recovery phase typically lasts 2 to 4 weeks but can take longer with severe barrier compromise. The first step in barrier repair is stopping all unnecessary irritants. This means discontinuing strong actives temporarily. Stop salicylic acid, benzoyl peroxide, and retinoids. Stop chemical exfoliants. Stop high-concentration vitamin C or other potentially irritating ingredients. Use only gentle, basic skin care during the recovery phase. Gentle cleansing becomes paramount. Use only lukewarm or cool water with a very gentle, minimal cleanser or even just water cleansing. Avoid all manipulation or massage of the skin. Pat dry gently, don't rub. Minimize cleansing time, wash quickly and gently rather than scrubbing or massaging. Lipid-rich moisturizing is essential. Your barrier needs ceramides, cholesterol, and fatty acids. Moisturizers containing these lipids support barrier repair. Apply moisturizer to slightly damp skin immediately after cleansing to lock in hydration. Use generous amounts, don't skimp on moisturizer during barrier repair. Many people find that using moisturizer 3 to 4 times daily during barrier repair accelerates recovery compared to twice daily application. Humectant-rich products maintain skin hydration. Ingredients like hyaluronic acid, glycerin, and squalane draw water into the skin, supporting hydration during barrier repair. Many hydrating serums or essences contain these ingredients. Apply these before your moisturizer to layer hydration. Some people benefit from occlusive products during barrier repair. An occlusive final layer locks moisture into skin. Facial oils, jojoba, squalane, or balms create an occlusive layer over your moisturizer. This is particularly helpful at night when you're not exposed to environmental stressors. Centella asiatica, 𝒂𝒂𝒄𝒊𝒂𝒍, is a botanical ingredient that supports skin barrier repair through multiple mechanisms. It strengthens the barrier, reduces inflammation, and promotes skin resilience. Many products now contain 𝒂𝒂𝒄𝒊𝒂𝒍 for its barrier-supportive properties. Using a 𝒂𝒂𝒄-containing product during barrier repair can accelerate recovery. Avoid all environmental stressors during barrier repair. Don't expose skin to extreme temperatures, hot showers, very cold weather. Use a humidifier to maintain ambient humidity, as dry air worsens barrier compromise. Avoid air conditioning when possible, it's drying, or use a humidifier to counteract its effects. Protect skin from sun exposure. Wear sun protection even though you're not using UV sensitizing treatments. Avoid actives and potential irritants completely during barrier repair. This means no vitamin C, no niacinamide in high concentrations, no peptides, no strong antioxidants. Even gentle ingredients might irritate severely compromised skin. Stick to cleanse, hydrate, moisturize, protect as your only routine. Timeline for barrier recovery typically takes 2 to 4 weeks. By week 1, you should notice reduced tightness and reactivity. By week 2, increased tolerance and reduced dryness. By week 3 to 4, most barrier compromise resolves. However, severely compromised barriers might take 6 to 8 weeks for complete recovery. During barrier recovery, you can still protect your skin from future acne. Using SPF 30+ sunscreen is essential and doesn't compromise recovery. In fact, it supports it by protecting your recovering skin. Sunscreen should be your only active product during this phase. Once your barrier has recovered, you're comfortable, no longer experiencing tightness or reactivity, and your skin feels resilient again, you can gradually reintroduce active treatments. However, do so carefully and at lower concentrations and frequencies than you used before. For example, if you were using 2% salicylic acid daily before barrier compromise, restart with 0.5% salicylic acid 2 to 3 times weekly. Build up slowly. Reintroduce treatments one at a time, waiting at least 1 to 2 weeks between introducing new actives. For example, reintroduce salicylic acid first, wait 2 weeks to ensure tolerance, then introduce benzoyl peroxide if desired. This sequential approach prevents recompromising your barrier. The barrier repair phase teaches valuable lessons about acne treatment. It emphasizes that more aggressive treatment isn't always better. Often, moderate treatment applied consistently yields better long-term results than aggressive treatment causing barrier compromise requiring recovery phases. Maintaining a healthy barrier improves overall skin health and can actually improve acne outcomes by supporting skin function. Some people find that once their barrier recovers, they can maintain clear skin with gentler treatment than they used before barrier compromise. For example, someone might have needed 2% salicylic acid daily and benzoyl peroxide to control acne, but after barrier recovery and switching to gentler 0.5 to 1% salicylic acid with retinoid maintenance, their acne stays controlled. This suggests that excessive barrier compromise actually worsened acne by disrupting skin function. Prevention is better than recovery. From the start of acne treatment, use appropriate concentrations and frequencies, incorporate moisturizing and barrier support, and listen to your skin's signals. If your skin is becoming very dry, tight, or reactive, reduce treatment intensity rather than continuing and causing more barrier damage. Long-term consistency matters more than short-term intensity. Guide 27. Cosmeceuticals and advanced skincare ingredients beyond standard acne treatments. Beyond the well-established acne treatments like benzoyl peroxide and salicylic acid, numerous cosmeceutical ingredients support acne treatment and skin health. Understanding these advanced ingredients allows you to optimize your acne regimen and support overall skin function. Peptides are short chains of amino acids that support skin structure and function. Some peptides have been studied for acne-supportive effects through anti-inflammatory mechanisms and barrier support. Matrixyl and similar peptides appear in many skincare products. While peptides aren't primary acne treatments, they support overall skin health and resilience. They're generally gentle and well tolerated. Include peptides in your routine for general skin support without expecting them to treat acne directly. Hyaluronic acid is a humectant that holds up to 1,000 times its weight in water, providing significant hydration. While it doesn't treat acne, maintaining proper hydration through hyaluronic acid improves skin function and barrier health. Using hyaluronic acid serums or moisturizers provides hydration support for acne-prone skin. Squalane is a lightweight oil that mimics skin's natural sebum without being comedogenic in most individuals. It provides hydration and lipid support for barrier function. Squalane is particularly useful for acne-prone skin that needs lipid support without the pore-clogging risk of heavier oils. A few drops of squalane can be added to moisturizer or serum for enhanced hydration. Niacinamide, vitamin B3, has multiple beneficial effects for acne-prone skin. It has mild antibacterial and mild dryness. Zinc supplements taken orally may reduce acne severity, particularly in people who are zinc deficient. Zinc plays roles in immune function, wound healing, and anti-inflammatory processes. Studies show mixed results, but some demonstrate zinc supplementation improves acne, particularly in conjunction with other treatments. Typical zinc supplementation for acne is 25 to 50 mg daily. However, excessive zinc supplementation can cause nausea and copper deficiency, so don't exceed recommended doses without medical guidance. Consult your doctor before starting zinc supplements, particularly if you take other medications. Niacinamide, vitamin B3, is a natural compound with antibacterial, anti-inflammatory, and sebum-regulating properties. While available in supplements, topical niacinamide is more relevant for acne. Many skin care products now include 4 to 5% niacinamide. Studies demonstrate that niacinamide reduces sebum production and acne lesions with minimal irritation. It's suitable even for very sensitive skin and works well alongside other treatments. Azelaic acid, a naturally occurring compound found in grains like barley and rye, has proven antibacterial and anti-inflammatory properties. It's more commonly available as a prescription medication, Azalex, Phenacea, or in over-the-counter products, but azelaic acid is naturally derived. It's particularly effective for post-inflammatory hyperpigmentation and rosacea-related acne. Dietary changes based on research can improve acne. Eating antioxidant-rich foods like berries, dark chocolate, and colorful vegetables reduces inflammation throughout your body, including your skin. Omega-3 fatty acids from fish, walnuts, and ground flax seeds have anti-inflammatory effects and may reduce acne. Increasing fiber intake through whole grains and vegetables improves digestion and may improve skin. Reducing sugar and refined carbohydrates reduces blood sugar spikes that worsen acne. Hydration deserves special mention. Drinking adequate water, about 8 to 10 glasses daily, maintains skin hydration from within, supports detoxification, and promotes overall skin health. While water alone won't cure acne, adequate hydration is fundamental to clear skin. Sleep is profoundly important. During sleep, your body releases growth hormone and reduces cortisol, supporting skin repair and reducing inflammation. Poor sleep increases cortisol, promotes inflammation, and worsens acne. Consistently getting 7 to 9 hours of quality sleep significantly improves skin health and acne. Stress reduction through meditation, yoga, deep breathing, or regular exercise reduces cortisol and inflammation, directly improving acne. Chronic stress is a well-documented acne trigger. Even 10 to 15 minutes of daily meditation or yoga can measurably improve skin. Important limitations of natural remedies. Most natural remedies are suitable for mild acne only. If you have moderate to severe acne, particularly cystic acne, natural remedies are insufficient and you require professional treatment. Natural remedies work best alongside professional treatments, not as replacements. Natural doesn't automatically mean safe or effective. Many natural substances are irritating or ineffective for acne. Finally, natural remedies require consistent use for 4 to 8 weeks to demonstrate effectiveness. Don't expect immediate results. Guide 9. Spot Treatment Mastery. Targeted acne lesion treatment and prevention. Spot treatments allow you to apply potent acne-fighting ingredients directly to individual pimples, minimizing exposure to surrounding healthy skin. Mastering spot treatment techniques accelerates healing and prevents scars. Understanding when and how to use different spot treatments is essential for optimal results. Timing is everything with spot treatments. The most effective time to treat a pimple is at the earliest sign of its formation. Many people feel a small bump developing under their skin 1 to 2 days before it becomes visible. Applying spot treatment immediately when you feel this early bump can prevent it from fully developing. If you notice a pimple just starting to form, small, red, not yet inflamed, beginning treatment immediately can prevent significant inflammation and reduce healing time by days. Different pimple types require different treatments. For small whiteheads or pimples with visible centers, spot treatments with salicylic acid effectively flatten the pimple and accelerate healing. Apply a salicylic acid spot treatment directly to the whitehead using a clean cotton swab or applicator. For closed comedones or small flesh-colored bumps, salicylic acid is also most effective. For inflammatory red pimples without visible centers, benzoyl peroxide is more effective than salicylic acid. For large, painful, deep cystic acne, neither topical spot treatment alone is sufficient. These require professional dermatologist intervention. Intralesional steroid injections are highly effective for cystic acne. Preparation is important. Before applying any spot treatment, cleanse the area thoroughly to remove makeup, dirt, and oil. Pat the area dry completely. Applying spot treatments to damp skin reduces effectiveness and increases irritation. Wait a full 2 to 3 minutes after cleansing to ensure complete dryness. When applying spot treatment, use a clean applicator. Never apply with your finger as this spreads bacteria. Cotton swabs, disposable applicators, or sterile tools are appropriate. Apply a small amount directly to the pimple, covering just the lesion itself and a tiny bit of surrounding skin. Using too much spot treatment wastes product and irritates surrounding healthy skin. Spot treatment frequency depends on the product and your skin's tolerance. Salicylic acid spot treatments can typically be used twice daily, morning and evening, if your skin tolerates it. Benzoyl peroxide spot treatments should typically be used once daily initially, preferably at night, then increase to twice daily if your skin adapts well. Some very potent spot treatments are meant to be used only once or twice weekly. The less is more principle applies to spot treatments. Using more frequent applications or larger amounts doesn't accelerate healing, it only increases irritation and dryness. Consistent, moderate use is more effective than aggressive over-application. Never pick, squeeze, or extract pimples yourself unless absolutely necessary. Squeezing ruptures the follicle wall, pushing bacteria, sebum, and dead skin cells deeper into the skin. This spreads the pimple, increases inflammation, and significantly increases scarring risk. Additionally, using your fingers spreads bacteria to other areas of your face, causing more pimples. If a pimple has a visible white center and you feel you must extract it, use a professional extraction tool or, ideally, have a dermatologist perform professional extraction. If you do extract a pimple, do so properly. First, apply a warm compress for 10 minutes to soften the plug and open the pore. Use a sterile lancet or extraction tool, available at pharmacies or dermatology offices, to make a tiny puncture or use an extraction loop to gently apply pressure around the pimple. Never use fingernails. After extracting, immediately apply an antiseptic and then an acne treatment. This approach minimizes the damage compared to aggressive squeezing. Acne patches are an excellent spot treatment innovation. These hydrocolloid bandages, infused with acne-fighting ingredients like salicylic acid, are applied over pimples. They absorb pus and oil from the pimple while protecting it from external bacteria and irritation. Acne patches work best on surface pimples with visible centers rather than deep cystic acne. They're typically left on for 6 to 8 hours or overnight, providing results within 6 to 8 hours to overnight for responsive pimples. Many people use acne patches under makeup during the day or overnight. They're convenient, visible results-oriented, and non-irritating. Pimple patches containing active ingredients like salicylic acid, benzoyl peroxide, or tea tree oil are superior to regular hydrocolloid bandages. However, regular hydrocolloid bandages provide some benefit through moisture management and protection even without active ingredients. Spot treatment serums and gels remain on your skin, typically used twice daily. Apply after cleansing and before moisturizer. Common spot treatment actives include benzoyl peroxide, salicylic acid, azelaic acid, and sulfur. Choose based on your pimple type. Inflammatory acne responds better to benzoyl peroxide, comedonal acne to salicylic acid. For very aggressive spot treatment, some dermatologists recommend combining low concentrations of different actives, perhaps a small amount of salicylic acid followed by a small amount of benzoyl peroxide on the same pimple. However, this should only be done if your skin tolerates it well and should be used sparingly. For most people, one spot treatment at a time is appropriate. Sulfur spot treatments are often overlooked but can be highly effective, particularly for inflammatory acne and sensitive skin. Sulfur has been used in dermatology for over a century and has proven antibacterial and anti-inflammatory properties. Some people find sulfur more tolerable than benzoyl peroxide or salicylic acid. Intralesional steroid injections administered by dermatologists are the gold standard for large, painful cystic acne. A small amount of steroid is injected directly into the cyst, causing it to deflate and heal within days. This prevents the cyst from persisting for weeks or months and significantly reduces scarring risk. If you have large cystic acne, ask your dermatologist about this option. Common mistakes with spot treatments include starting with too strong products, using them too frequently, using too much product, expecting overnight complete resolution, or abandoning consistency after just a few days. Spot treatment works best with realistic expectations. A moderate pimple treated consistently for 3 to 5 days should flatten and improve noticeably. Large cystic pimples take longer and may require professional intervention. Guide 10. Strategic moisturizing for acne-prone skin, hydration without triggering breakouts. One of the most common and damaging myths about acne is that people with acne shouldn't use moisturizer. This myth causes countless people to have dry, irritated, sensitive skin that's actually more prone to acne. Proper moisturizing is absolutely essential for acne-prone skin, and understanding how to moisturize without clogging pores is critical. The reality is that acne-prone skin, especially if you're using acne treatments, desperately needs moisturizer. Here's why. When your skin is dehydrated, it compensates by producing more sebum. This excess sebum actually worsens acne. Additionally, most acne treatments, salicylic acid, benzoyl peroxide, retinoids, cause dryness and irritation. Using moisturizer counteracts these side effects, allowing you to continue treatments without excessive discomfort. Finally, properly hydrated skin has a stronger barrier function, which improves overall skin health and actually reduces acne. The key to moisturizing acne-prone skin is selecting appropriate products. Look for moisturizers specifically formulated as non-comedogenic, meaning they don't clog pores. Treatments, typically 3 to 6, provide progressive improvement. Laser resurfacing works for all scar types but is most effective for shallow scars and ice pick scars. Dermal fillers inject material beneath scars to fill depressions temporarily. Different fillers last varying lengths. Some last 6 months, others 1 to 2 years. This approach works well for ice pick and boxcar scars but requires repeat treatments. Filler results are immediate, making this attractive for short-term improvement. Microneedling creates controlled microinjuries, stimulating collagen production and remodeling scarred tissue. Multiple sessions, typically 4 to 6, provide progressive scar improvement. Microneedling works for all scar types and is relatively affordable compared to laser treatments. Chemical peels can improve shallow scars through repeated treatments. TCA, trichloroacetic acid, peels at medium depth can improve scar appearance, though results are less dramatic than laser or microneedling. Treatment selection depends on scar type, depth, and individual factors. Dermatologists typically recommend combination approaches, perhaps subcision combined with microneedling, or laser resurfacing combined with fillers. Severe, extensive scarring might warrant multiple treatment types performed sequentially. Realistic expectations are essential. Most scars can be significantly improved but rarely completely eliminated. Even after multiple treatments, mild scarring typically remains. However, significant improvement is usually achievable with appropriate treatments. Guide 13: Face masks and professional facials for acne management. Face masks and professional facials supplement your daily skincare routine, providing concentrated treatments and professional expertise. Understanding various mask types and facial treatments helps you select appropriate options for your skin concerns. Clay masks absorb excess oil and impurities, making them ideal for oily, acne-prone skin. Green clay and kaolin clay are particularly effective. These masks draw out sebum, bacteria, and impurities from pores. Use clay masks 1 to 2 times weekly for 10 to 15 minutes on clean skin. Apply evenly, avoiding the eye area. As the mask dries, you'll feel slight tightening as oil is extracted. Rinse with lukewarm water and follow with moisturizer, as clay masks can be drying. Sheet masks infused with acne-fighting ingredients like salicylic acid, tea tree oil, or niacinamide provide targeted treatment and hydration simultaneously. Apply sheet masks to clean skin for 15 to 20 minutes, then remove and pat remaining serum into skin. Use 2 to 3 times weekly. Sheet masks are convenient, mess-free, and come in numerous formulations targeting specific concerns. Hydrating masks with hyaluronic acid, glycerin, or ceramides balance skin and prevent overdrying from acne treatments. These masks are essential if your acne treatment regimen is causing excessive dryness. Use hydrating masks 1 to 2 times weekly, particularly on days when you're using strong actives like retinoids or chemical exfoliants. Mud masks similar to clay masks draw impurities from pores while providing mineral content. Some formulations include additional active ingredients. Used similarly to clay masks, 1 to 2 times weekly for 10 to 15 minutes. Charcoal masks draw impurities from deep within pores. While popular, they can be overly drying. Use sparingly, perhaps monthly, if you have very oily skin. Avoid if your skin is dry or sensitive. Overnight masks are left on overnight and act as intensive treatments. Some are essentially very rich moisturizers, while others contain actives like retinol or acids. These work well for providing intensive treatment without time constraints. Apply as your final nighttime step and sleep with the mask on. Spot masks apply highly concentrated treatments to specific areas rather than your entire face. These are useful when some areas are more problematic than others. Apply to clean skin and leave on as directed. Important mask principles: never use multiple mask types on the same day. Choose one mask per skincare session. Always follow mask application with appropriate moisturizer, as masks can be drying. Start with masks once weekly, increasing frequency only as your skin demonstrates tolerance. Don't leave masks on longer than recommended. Longer application doesn't mean better results and risks overdrying. Masks are supplements to your core routine, not replacements for daily cleansing and treatment. Professional facials go beyond at-home masks, utilizing professional strength products, specialized equipment, and esthetician expertise. A typical acne-focused facial includes cleansing, exfoliation, extraction, treatment mask, and moisturizer application. The extraction component, professional removal of comedones, provides benefits impossible to achieve safely at home. Hydrofacial uses suction technology to extract impurities from pores without harsh manual extraction. A spiral tip applies suction while simultaneously infusing treatment serums. Hydrofacials provide immediate visible improvement, particularly for comedones. Most people see results after a single treatment, with cumulative benefits after 4 to 6 treatments performed monthly. Chemical peel facials use professional strength acids, glycolic acid, salicylic acid, or lactic acid, to exfoliate multiple skin layers. Superficial peels cause mild redness and slight flaking but require no downtime. Medium peels cause more significant exfoliation and require several days of recovery. Chemical peels improve acne, texture, and hyperpigmentation significantly. Monthly superficial peels or quarterly medium peels provide excellent results. Blue light therapy facials use specific light wavelengths to kill acne-causing bacteria. Blue light, around 415 nanometers wavelength, is particularly effective against Cutibacterium acnes. Treatments typically last 15 to 20 minutes. Most treatment plans include 6 to 8 sessions, sometimes combined with red light therapy for inflammation reduction. Blue light therapy is particularly valuable for those seeking non-chemical treatment or for bacterial acne resistant to other treatments. Microdermabrasion facials use fine crystals or a diamond tip to physically exfoliate skin. This removes dead skin cells, unclogs pores, and stimulates collagen production. Results are immediate visible skin smoothing. Regular microdermabrasion, monthly, maintains clear skin and improves texture. Oxygen facials infuse pressurized oxygen with serums deep into skin. While marketed aggressively, evidence for exceptional benefits is limited. However, many people report improved hydration and glow after oxygen facials. Dermaplane facials use a sterile blade to remove fine facial hair and provides exfoliation and hair removal simultaneously. Results are immediate, smooth, bright skin. However, dermaplaning isn't appropriate for acne-prone or actively inflamed skin, as the blade can irritate lesions. Laser facials use laser technology for exfoliation, collagen stimulation, and targeted treatment of specific concerns. Fractional laser facials are gentler than full laser resurfacing and provide results with minimal downtime. Professional facials are most effective when combined with consistent home skincare. Monthly professional treatments combined with daily gentle skincare is foundational for rosacea. Avoid physical scrubs, harsh cleansers, and irritating products. Use fragrance-free, gentle cleansers and soothing moisturizers. Many rosacea patients benefit from products containing Centella asiatica, cica, oat extract, or hyaluronic acid. Avoid very hot water, using lukewarm water instead. Don't use topical corticosteroids chronically, as they worsen rosacea over time. Azelaic acid is highly effective for rosacea, approved by the FDA for this condition. At 15 to 20% concentration, applied twice daily, azelaic acid reduces redness, pustules, and flushing. This is one of the few treatments that's both gentle enough for rosacea and sufficiently potent to provide real benefit. Oral antibiotics, particularly doxycycline at subantimicrobial doses, reduce rosacea inflammation. Low-dose doxycycline, 20 to 50 mg daily, has anti-inflammatory effects beyond its antibacterial properties. Metronidazole is another oral option. Topical metronidazole gel also reduces rosacea symptoms. Topical sulfacetamide sulfur products help control rosacea, particularly pustular rosacea. These are gentle enough for sensitive rosacea-prone skin while providing therapeutic benefit. Laser treatments, particularly those targeting blood vessels, vascular lasers, effectively reduce rosacea's persistent redness and visible blood vessels. Multiple treatments are typically necessary. Intense pulsed light, IPL, therapy is also effective for rosacea. Seborrheic dermatitis causes inflammation, redness, and flaking, often on the face, scalp, and other oily areas. Unlike acne, seborrheic dermatitis involves fungal overgrowth, Malassezia yeast, and isn't bacterial. Antifungal treatments are therefore necessary. Topical antifungals like ketoconazole, zinc pyrithione, or selenium sulfide reduce seborrheic dermatitis. These are available in shampoos, creams, and lotions. Antifungal products should be applied to affected areas 1 to 2 times daily until improvement, then used for maintenance. Mild topical corticosteroids reduce inflammation and itching in seborrheic dermatitis. However, chronic steroid use can worsen the condition, so use them short-term or intermittently. Perioral dermatitis presents as a rash around the mouth, often triggered by heavy moisturizers or topical corticosteroids. Treatment involves stopping the trigger, typically discontinuing steroids or heavy moisturizers, using gentle, minimal skin care, and sometimes using topical antibiotics. Low-dose oral doxycycline sometimes helps. Fungal acne, Pityrosporum folliculitis, appears similar to acne but results from yeast overgrowth rather than bacterial acne. It typically appears as small, uniform pustules, often on the back and chest. Standard acne treatments don't help, antifungal treatments are necessary. Topical antifungals, ketoconazole, zinc pyrithione, or oral antifungals, fluconazole, itraconazole, are effective. Some dermatologists recommend oral antifungals even for facial fungal acne due to systemic involvement. Folliculitis is inflammation of hair follicles, appearing similar to acne but resulting from bacteria, irritation, or friction rather than typical acne pathophysiology. Treatment depends on the cause. Bacterial folliculitis responds to antibiotics or benzoyl peroxide, but other folliculitis types may require different approaches. Professional diagnosis ensures appropriate treatment. Post-inflammatory erythema is persistent redness remaining after acne heals, different from permanent scarring. This redness gradually fades over months with sun protection and time. Vascular lasers or intense pulsed light can accelerate resolution of stubborn erythema. Professional diagnosis is essential when you're uncertain whether you have acne or another condition. Many conditions are treatable once properly identified, but misdiagnosis leads to frustration and worsening symptoms. If your acne doesn't respond to standard treatments or presents atypically, ask your dermatologist to rule out other conditions. Guide 18: Managing Acne Treatment Side Effects and Building Tolerance. Most effective acne treatments cause side effects during initial use. Understanding how to manage these side effects allows you to continue treatments despite discomfort, achieving clear skin. Side effects typically diminish as your skin adapts, but managing them during the adaptation phase is important. Dryness is the most common side effect of acne treatments. Salicylic acid, benzoyl peroxide, retinoids, and sulfur all commonly cause dryness. Manage dryness through aggressive moisturizing. Increase moisturizer frequency to twice daily, morning and night, or even 3 times daily if necessary. Choose hydrating, non-comedogenic moisturizers with hyaluronic acid, glycerin, or ceramides. Apply moisturizer to damp skin to lock in hydration. Use the sandwich method if dryness is severe. Apply your treatment, wait 20 minutes, then apply moisturizer, wait a few minutes, then apply another thin layer of moisturizer. Some people find using a facial oil, just a few drops, over moisturizer helpful for managing dryness, though oils can clog pores in susceptible individuals. If oil worsens your acne, skip this step. Peeling and flaking occur frequently with chemical exfoliants and retinoids. Mild peeling indicates exfoliation is working. However, severe peeling suggests your treatment concentration or frequency is too aggressive. Manage peeling by reducing treatment frequency. Use 2 to 3 times weekly instead of daily, reducing concentration. Switch from 2% salicylic acid to 1%, or using shorter treatment durations. Don't pick or peel flaking skin manually, as this damages your skin barrier further. Instead, gently pat moisturizer onto flaking areas and allow them to shed naturally. Redness and irritation are common initially, particularly when starting retinoids or high-concentration treatments. Mild redness that resolves within a few hours is normal. Severe, persistent redness suggests your treatment is too strong. Reduce frequency or concentration. Use the sandwich method to reduce irritation. Apply soothing products like aloe vera or Centella asiatica. If redness persists despite these measures, discontinue the treatment temporarily and consult your dermatologist. UV sensitivity occurs with retinoids, chemical exfoliants, and some other treatments. This doesn't necessarily mean you'll burn easily, but your skin is more susceptible to sun damage. Use SPF 30+ sunscreen daily, reapply every 2 hours if outside, and seek shade during peak sun hours. Wear protective clothing and hats if possible. This is non-negotiable when using photosensitizing treatments. Purging is temporary worsening of acne when starting certain treatments, particularly retinoids and strong exfoliants. Purging occurs as the treatment brings impurities to the skin surface and accelerates cellular turnover. Purging is usually a positive sign that your treatment is working, though it's unpleasant. Purging typically lasts 1 to 2 weeks but can persist up to 4 weeks. If purging lasts beyond 4 weeks or becomes unbearable, discontinue the treatment and consult your dermatologist. Contact dermatitis, allergic reaction, to products appears as itching, rash, or swelling. This is different from typical irritation. If you develop contact dermatitis, discontinue the product immediately. Identify the specific ingredient causing the reaction and avoid it in future products. Common allergens include benzoyl peroxide, sulfur, and certain plant extracts. Hormonal side effects may occur with spironolactone or oral contraceptives. Dizziness, lightheadedness, menstrual irregularities, and breast tenderness are possible. Report any concerning symptoms to your healthcare provider. Regular blood tests ensure your potassium levels and kidney function remain healthy if taking spironolactone. Sensitivity and compromised barrier function result from overuse of strong treatments. Your skin feels tight, uncomfortable, and is reactive to previously tolerated products. Laser treatments require careful consideration for darker skin types. Many traditional lasers carry higher complication risk in darker skin, including post-inflammatory hyperpigmentation and depigmentation. Lasers specifically designed for darker skin types or lower fluence approaches are preferable. This is one area where working with dermatologists experienced in treating darker skin types is particularly important. Cultural attitudes toward acne and appearance affect treatment seeking and treatment consistency. Some cultures have strong stigma around acne, while others are more accepting. Understanding your cultural context and how it affects your response to acne helps manage psychological impact. Genetic predisposition to acne varies somewhat across ethnic backgrounds. Some populations have higher acne prevalence, though individual variation is substantial and environmental factors play large roles.
第2幕、裁きの重み。店は、上品な書で、菊と書かれた控えめな木製の看板で姿を現した、菊の花。𝑭𝒂𝒄𝒆はその入り口の前に立っていた。蜂蜜色の木で作られた引き戸からは、高級感と特別感が静かに伝わってくる。障子越しには、朝の仕込みの音がかすかに聞こえた、まな板を叩く包丁のリズム、水が流れる音、鋼同士がぶつかる金属音。彼は到着の時間を入念に測った、午前10時47分。朝食の片付けが終わり、昼の準備に取り掛かるその狭間は、厨房が人手の必要を見極める絶妙なタイミングだ。引き戸を開ける彼の手は、わずかに震えていた。いらっしゃいませ。奥から自動的に声がかかり、慌ただしい足音が続いた。真新しい着物を着た若い女性が現れ、笑顔で迎えかけたが、ＫＯＯの姿を見るとその笑みが一瞬で曇った。あ、すみません、おじさん。彼女は高齢の男性に使う砕けた呼び方でそう言った。それはＫＯＯの胸に小さな刃のように突き刺さった。お昼の営業は正午からなんです。求人の件で来ました。ＫＯＯは声を乱さずに答えた。厨房スタッフの募集です。彼女の目は、擦り切れたカーディガン、年齢を感じさせる手、わずかに前かがみになった背中を素早く見回した。あ、少々お待ちください。 彼女は奥へ引っ込み、ＫＯは玄関先に配達員のように取り残された。店内は本気度を物語っていた。ヒノキの一枚板でできた長いカウンターは、すべての席が寸分の狂いもなく配置されている。カウンターの奥では厨房が輝いていた。磁気ストリップに並んだドイツ製の包丁、光を反射して小さな太陽のように輝く銅鍋。しつらえは現代的でありながら伝統への敬意を忘れていない若い世代がネオ懐石と呼ぶスタイルだ。何の用だ？威厳を含んだ声が空気を切った。厨房から男が現れた。35歳くらいだろうか、白衣は刃物のようにパリッとしている。シェフもはおしゃれに傾けられ、両腕には真剣に厨房を渡り歩いてきたことを物語る火傷と傷跡が刻まれていた。これが、この店の料理長なのだろ
う。Guide 41, Microneedling RF and Advanced Microneedling Technologies for Acne Scarring. Advanced microneedling technologies combine traditional microneedling with additional energy sources or techniques for enhanced results in acne scar treatment. Understanding these advanced options helps you select appropriate professional treatments. Radiofrequency, RF, microneedling combines microneedling with radiofrequency energy delivered through the needles. As needles penetrate skin, they deliver RF energy at depth, providing enhanced collagen stimulation compared to standard microneedling. The combination approach produces more dramatic results but with more significant post-treatment appearance changes. Recovery involves 5 to 7 days of significant redness and swelling compared to 3 to 5 days for standard microneedling. Microneedling depth significantly affects results and recovery. Shallow microneedling, 0.5 mm, primarily addresses surface concerns with minimal downtime. Medium depth, 1 to 1.5 mm, addresses scarring moderately with moderate downtime. Deep microneedling, 2.0 to 2.5 mm, addresses severe scarring most effectively but with significant recovery time and complication risks. Your practitioner determines appropriate depth based on scar severity and recovery tolerance. Fractional microneedling treats portions of skin rather than entire areas, leaving some skin untouched for faster healing. This approach provides good scar improvement with reduced downtime compared to full-face treatment. Multiple sequential treatments spaced 4 to 6 weeks apart provide cumulative improvements superior to single treatments. Most scar improvement appears over 3 to 6 months following each treatment as collagen remodels. Treatment plans typically involve 3 to 6 sessions. Post-treatment care optimizes results. Aggressive sun protection, SPF 50+, daily application, reapplication every 2 hours outdoors, is crucial during recovery. Healing serums with growth factors support skin recovery. Avoiding active ingredients during recovery week allows skin barrier to heal. Resuming actives cautiously after recovery supports ongoing improvement. Combining microneedling with other scar treatments, subcision, fillers, laser, often provide superior results to any single approach. Your dermatologist can recommend appropriate combinations for your specific scars. Guide 42, Emerging Probiotic and Postbiotic Skincare Research. Probiotic and postbiotic skincare represents an emerging frontier addressing acne through microbiome support. Understanding this emerging field helps you evaluate whether these approaches might benefit your skin. Topical probiotics contain live bacteria applied to skin. While the colonization potential of topical probiotics on skin is limited, skin has established microbiota that resists colonization. These products may provide benefit through bacterial metabolites and immune stimulation. Some evidence suggests certain probiotic strains reduce acne severity modestly. Postbiotics are metabolites produced by bacterial fermentation, essentially the waste products of probiotics with bioactive properties. Postbiotic serums contain these metabolites without live bacteria, avoiding stability and colonization concerns of live probiotics. Postbiotics show promise for reducing inflammation and supporting skin barrier. Fermented ingredients, products where plant ingredients have been fermented by beneficial bacteria, provide postbiotic-like benefits. These fermented products often have enhanced stability and penetration compared to non-fermented counterparts. Evidence for probiotics and postbiotics remains emerging rather than definitively proven. While some studies show modest benefits, high-quality large studies are limited. Probiotic and postbiotic skincare can supplement other treatments but shouldn't replace proven acne therapies. Quality matters significantly for probiotic products. High-quality products with documented effective strains are preferable to low-quality options. However, quality doesn't guarantee personal benefit. Guide 43: Artificial Intelligence and Personalized Acne Treatment. Artificial intelligence is beginning to transform dermatology through skin analysis and personalized treatment recommendations. Understanding these tools helps you evaluate whether AI-guided approaches might supplement your dermatology care. Reframing skincare as health maintenance rather than beauty obligation increases motivation for some people. Viewing skincare as caring for your body's largest organ similar to exercising or eating well helps maintain consistency even when acne is controlled. Celebrating milestones and achievements maintains motivation. Reaching certain milestones, 8 weeks of consistent routine, first month of clear skin, oral antibiotics like doxycycline, risks to fetus and teeth, spironolactone, potential effects on male fetus development. Benzoyl peroxide is traditionally avoided though new evidence suggests safety. Potentially safe during pregnancy. Topical salicylic acid used in small amounts and limited areas. Large-scale systemic absorption possible though typically minimal. Topical azelaic acid, generally considered safe. Topical clindamycin, some. Routine predictability helps sensory-sensitive individuals. Consistent routines in consistent order reduce sensory overwhelm compared to variable routines. Minimal product routines, fewer products means fewer sensory inputs, might be better tolerated than complex multi-step routines. A simple cleanse, treat, moisturize routine might work better than elaborate routines. Fragrance sensitivity affects many products. Fragrance-free or lightly scented products work better for fragrance-sensitive individuals. Sensory-friendly product recommendations: lightweight serums, fragrance-free formulations, smooth-absorbing products, minimal texture variations, consistent temperatures, and routines. Professional guidance from dermatologists familiar with sensory sensitivities helps develop manageable treatment plans. Guide 90: Acne and Chronic Illness, Managing Acne while Managing Other Conditions. People managing chronic illnesses, diabetes, autoimmune diseases, chronic fatigue, etc., face additional challenges managing acne alongside other health concerns. Chronic illness causes stress, sleep disruption, and immune dysfunction, all acne-worsening factors. Flares of underlying chronic conditions often coincide with acne worsening. Medications for chronic illnesses sometimes interact with acne treatments, requiring careful coordination. Energy limitations from chronic illness might make complex skincare routines unsustainable. Simplified routines are sometimes necessary. During chronic illness flares, simplifying skincare to basic cleanse protect routines is appropriate. During periods of better health, more comprehensive acne treatment is possible. Mental health in chronic illness overlaps with acne's psychological burden. Both require professional support. Healthcare provider coordination between specialists treating chronic illness and dermatology ensures appropriate care. Prioritizing which health concerns to focus on during periods of limited energy helps. Sometimes managing underlying chronic illness takes priority over aggressive acne treatment. Guide 91, Acne Treatment and Vaccination, Timing and Considerations. Concerns sometimes arise about acne medication interactions with vaccines or vaccine effects on acne. Most acne treatments don't interact meaningfully with vaccines. Topical treatments have minimal systemic absorption and don't affect vaccines. Oral antibiotics for acne don't affect vaccine efficacy. Vaccines should be given as scheduled regardless of antibiotic use. Isotretinoin doesn't interact with vaccines, though the immune system suppression during severe acne might theoretically reduce vaccine efficacy. Live vaccines are contraindicated during isotretinoin use due to theoretical immunosuppression risks, though actual risks are minimal. Some vaccines might cause temporary acne flares through immune system activation. This is temporary and doesn't indicate vaccine problems. Vaccines don't cause persistent acne. Any acne appearing after vaccination is likely coincidental timing rather than vaccine-related. COVID-19 vaccines have not been shown to affect acne or interact with acne treatments. Timing vaccines around acne treatment is generally unnecessary. Vaccinations and acne treatment can proceed on standard schedules without coordination. Guide 92, Acne Prevention in High-Risk Children and Adolescents. Children with strong family history of severe acne are at high risk for developing severe acne. Early prevention strategies might prevent progression to severe acne requiring aggressive treatment. Starting gentle skin care routines early, non-comedogenic cleansing, sun protection, gentle moisturizing, establishes good habits before acne develops. Education about acne prevention helps young people understand triggers and prevention even before acne appears. Stress management skills learned early help reduce stress-related acne worsening later. Healthy diet and sleep habits established in childhood support skin health throughout life. Early intervention at first signs of acne prevents progression. Some dermatologists recommend seeing high-risk children early for preventive guidance. Avoiding triggers identified through family acne patterns, particular foods, products, environmental factors, might prevent acne development. Psychological preparation for potential acne, normalizing that acne is common, reducing stigma, helps adolescents manage it psychologically if acne develops. Guide 93, Acne in Performing Arts and Image-Dependent Professions. Performers and those in image-dependent professions, models, actors, social media influencers, experience unique acne-related pressures warranting specialized management. Career-threatening pressure intensifies acne's psychological impact. A small breakout affecting someone's livelihood differs from same breakout's impact on others. Professional makeup demands acne coverage requiring heavy makeup potentially triggering acne cosmetica. Using non-comedogenic makeup and proper removal helps minimize this. Professional headshots and promotional photos emphasize clear skin. Acne interferes with professional image management. Scheduling professional appearances around acne cycles when possible helps. If acne is cyclical, scheduling performances during clear phases. Professional dermatology involvement is often valuable for ensuring consistently clear skin during critical professional periods. Some performers use preventive acne treatment intensification before important performances, temporarily increasing treatment frequency. Mental health support helps manage the intensified appearance pressure these professions create. Guide 94, Acne and Sleep Disorders, Managing Acne while Managing Sleep Issues. Sleep disorders, insomnia, sleep apnea, restless leg syndrome, create multiple acne worsening factors, making acne management more challenging. Sleep deprivation from any sleep disorder worsens acne through stress hormone, immune, and inflammatory mechanisms. Sleep medications sometimes worsen acne. Discussing with sleep specialists whether acne worsening might relate to sleep medications is appropriate. Treating underlying sleep disorders often improves acne significantly through improved sleep quality and stress reduction. Managing both sleep and acne requires comprehensive approach addressing both conditions. CPAP machines and other sleep disorder treatments might trigger acne through skin irritation. Using protective barriers and keeping equipment clean helps. Guide 95, Acne and Fertility, Female and Male Considerations. Acne treatments have fertility implications requiring consideration for those planning pregnancy or concerned about fertility. Isotretinoin is highly teratogenic and absolutely contraindicated in pregnancy. Women of childbearing age must use reliable contraception while on isotretinoin. Spironolactone might affect male fetus development. Stopping spironolactone while planning pregnancy or if pregnancy occurs is generally recommended. Birth control pills used for hormonal acne obviously affect fertility planning. Stopping pills when planning pregnancy allows pregnancy attempt. Other acne treatments don't significantly affect fertility and can be continued during fertility attempts. Male fertility is theoretical, even when staying indoors, is important when using acne treatments. Window glass blocks most UVB rays but not UVA rays, meaning significant UV damage can occur through windows. If you're at a desk near a window or driving frequently, you're receiving substantial UV exposure even without being outdoors. Sunscreen reapplication is necessary if you're outside for extended periods. Reapply every 2 hours, or immediately after swimming or sweating. For convenient reapplication over makeup, use sunscreen powder, sunscreen mist, or simply reapply your liquid sunscreen gently over makeup. Additional sun protection measures supplement sunscreen. Wear protective clothing, long sleeves, pants, and hats when possible. Sunglasses protect the delicate eye area and surrounding skin. Seek shade during peak UV hours, 10 a.m. to 4 p.m., when UV intensity is highest. Even with perfect sunscreen use, additional protection measures are valuable. Vitamin D production requires some UV exposure, so complete sun avoidance isn't necessary or healthy. However, brief incidental sun exposure during daily activities provides adequate vitamin D while protecting skin involves consistent sunscreen use and protective measures during extended outdoor activities. Sunscreen ingredients sometimes interact with other skincare products. Benzoyl peroxide can reduce some sunscreen ingredient effectiveness. Apply sunscreen after benzoyl peroxide and wait a few minutes before reapplying other products. Generally, sunscreen should be your final skincare step before makeup. If you develop a sunburn despite sunscreen use, cool compresses, hydration, and soothing products like aloe vera help. Avoid further sun exposure until healed. Severe sunburns are dangerous and should be treated seriously. However, if you're using appropriate sunscreen correctly and minimizing peak sun exposure, severe sunburns should be rare. Guide 12. Treating post-inflammatory hyperpigmentation and acne scarring. After acne heals, two primary complications can persist: post-inflammatory hyperpigmentation, dark marks, and physical scarring. Understanding these conditions and the various treatment approaches available is essential for achieving truly clear skin, not just clear of active acne but also free from acne's lasting marks. Post-inflammatory hyperpigmentation, PIH, appears as flat, dark patches or spots where acne was previously present. These marks result from inflammation triggering excess melanin production in healing skin. PIH is particularly common in individuals with darker skin tones and in areas that received more inflammation or trauma. Unlike active acne, PIH doesn't involve bacteria or require acne-specific treatments. It requires treatments targeting melanin and pigmentation. Understanding PIH timeline is important for realistic expectations. Most PIH gradually fades naturally over 6 to 12 months with consistent sun protection, even without treatment. However, this timeline can feel unacceptably long, motivating people to pursue active treatments. The good news is that numerous treatments significantly accelerate PIH fading. Sunscreen is the foundational PIH treatment. UV exposure directly darkens hyperpigmentation, extending the timeline for natural fading. Using SPF 30+ daily and avoiding sun exposure accelerates PIH resolution dramatically. Some PIH that might take 12 months to fade with poor sun protection might fade within 3 to 4 months with strict sun protection. Vitamin C serums brighten hyperpigmentation and even skin tone. L-ascorbic acid at 15 to 20% concentration is most effective, though magnesium ascorbyl phosphate and other stabilized forms also work. Apply vitamin C serum daily in the morning before sunscreen. Results typically appear after 4 to 8 weeks of consistent use. Vitamin C also provides antioxidant protection and stimulates collagen production as a bonus benefit. Niacinamide reduces post-inflammatory redness and even skin tone. At 4 to 5% concentration in moisturizers or serums, applied daily, niacinamide shows improvements in PIH within 4 to 8 weeks. Niacinamide is gentle, suitable for even very sensitive skin, and works well in combination with other treatments. Azelaic acid is particularly effective for PIH. At 15 to 20% concentration, applied twice daily, azelaic acid reduces melanin production and even skin tone. Prescription azelaic acid, Azalex, Phenacea, is more potent than over-the-counter versions. Many dermatologists recommend azelaic acid specifically for PIH management. Results typically appear within 4 to 8 weeks. Kojic acid inhibits melanin production. Available in serums and creams at 1 to 2% concentration, applied daily, kojic acid gradually lightens hyperpigmentation. Results take 4 to 8 weeks of consistent use. Kojic acid is generally well tolerated but can cause mild irritation in some individuals. Hydroquinone is a prescription bleaching agent highly effective for hyperpigmentation. It directly inhibits melanin production. Prescription hydroquinone typically ranges from 2 to 4% strength, applied twice daily to affected areas. Results appear within 4 to 12 weeks. However, hydroquinone should not be used continuously for more than 3 to 4 months without medical supervision, as extended use can cause paradoxical darkening or an uncommon condition called achronosis. Hydroquinone is not suitable for everyone and requires dermatologist prescription and monitoring. Chemical peels accelerate PIH resolution. Superficial peels with glycolic acid or salicylic acid remove pigmented surface skin, revealing lighter skin underneath. Monthly superficial peels combined with daily topical treatments significantly accelerate PIH fading. Medium-depth peels provide more dramatic but riskier results and are typically only performed for severe PIH. Laser treatments effectively target hyperpigmentation. Q-switched lasers are specifically designed to break up melanin pigment, with different wavelengths targeting different pigment depths. These treatments provide results in 4 to 6 sessions, sometimes fewer for responsive PIH. However, laser treatment is expensive and carries risks of complications in darker skin types. IPL, intense pulsed light, therapy also addresses pigmentation effectively. Microdermabrasion physically removes pigmented surface skin through mechanical abrasion. Performed monthly, combined with topical treatments, it accelerates PIH resolution. However, it's less powerful than laser treatments and typically requires more sessions. Combination approaches yield best results. Most dermatologists recommend combining daily topical treatments, vitamin C, azelaic acid, or hydroquinone, with monthly professional treatments, chemical peels or laser. This dual approach treats PIH from multiple angles, achieving faster, more complete resolution. Acne scarring is a more permanent complication than PIH. Scarring results from significant inflammation destroying collagen, resulting in physical indentations or elevation of the skin. There are 3 main types of acne scars: ice pick scars, deep, narrow indentations; boxcar scars, wider, flat-bottomed indentations; and rolling scars, wave-like depressions. Prevention is the most effective scar treatment. Avoiding picking, squeezing, or extracting pimples prevents scarring. Treating acne aggressively prevents deep inflammation that causes scarring. Taking acne seriously and treating it promptly prevents severe scarring. For existing scars, multiple treatment options exist, though complete elimination is often impossible. The goal is significant improvement. Topical treatments are largely ineffective for true scarring, as scarring involves structural damage that topical products can't reverse. However, improving overall skin texture and treating associated hyperpigmentation can make scars less noticeable. Subcision is a minor surgical procedure where a needle is inserted under the scar, breaking the fibrous tissue causing the depression. This allows collagen to regenerate and fill the scar. Subcision works best for rolling scars and tethered scars. Results appear gradually over 6 to 12 months as new collagen forms. Laser resurfacing removes thin layers of skin, smoothing scars. Fractional laser resurfacing is less aggressive than full resurfacing and requires less downtime. Multiple treatments, typically 3 to 6, provide progressive improvement. Laser resurfacing works for all scar types but is most effective for shallow scars and ice pick scars. Dermal fillers inject material beneath scars to fill depressions temporarily. Different fillers last varying lengths. Some last 6 months, others 1 to 2 years. This approach works well for 𝒂𝒄𝒄 and boxcar scars but requires repeat treatments. Filler results are immediate, making this attractive for short-term improvement. Microneedling creates controlled microinjuries, stimulating collagen production and remodeling scarred tissue. Multiple sessions, typically 4 to 6, provide progressive scar improvement. Microneedling works for all scar types and is relatively affordable compared to laser treatments. Chemical peels can improve shallow scars through repeated treatments. TCA, trichloroacetic acid, peels at medium depth can improve scar appearance, though results are less dramatic than laser or microneedling. Treatment selection depends on scar type, depth, and individual factors. Dermatologists typically recommend combination approaches, perhaps subcision combined with microneedling, or laser resurfacing combined with fillers. Caffeine and alcohol intake timing affects sleep quality. Caffeine consumed in the afternoon or evening disrupts sleep onset and quality. Alcohol consumption in the evening worsens sleep quality even though it might initially make you drowsy. Avoiding caffeine after 2 p.m. and limiting evening alcohol consumption improves sleep. Exercise supports both sleep quality and acne management through multiple mechanisms. Regular aerobic exercise, 30 minutes, 5 times weekly, improves sleep quality, reduces stress, regulates hormones, and improves acne. However, exercising too close to bedtime, within 3 hours, might disrupt sleep. Exercising earlier in the day optimizes both sleep and acne benefits. Sleep-specific skincare involves protective measures during sleep. Applying a heavy, occlusive moisturizer or night cream before bed protects skin during nighttime and supports barrier health. Night creams are often richer than daytime moisturizers because you don't need to worry about appearance or mattifying for makeup. Overnight hydrating masks provide intense hydration during sleep. Some people use occlusive oils, just a few drops of facial oil over moisturizer, to lock in maximum hydration overnight. Retinoid application at night leverages sleep's restorative processes. Applying retinoids in the evening, or before bed if your routine allows, means they work while your skin undergoes growth and repair during sleep. This timing often provides better results than morning retinoid application, though this varies individually. Acne spot treatments can be applied before bed to work overnight without interfering with daytime activities. Leaving benzoyl peroxide or other treatments on overnight provides extended contact time for therapeutic benefit. Silk or satin sleep masks or pillowcases are promoted for anti-aging and acne benefits. The reduced friction might slightly reduce acne, and the reduced moisture absorption compared to cotton might help slightly, but these effects are modest compared to other acne management strategies. If you like the feel of silk pillowcases and can afford them, they're worth trying, but they're not necessary for acne management. Optimizing sleep requires a multifaceted approach, maintaining 7 to 9 hours nightly, keeping consistent sleep schedules, avoiding evening screen use, limiting caffeine after 2 p.m., maintaining cool, moderate humidity bedroom, and changing pillowcases frequently. These changes take 2 to 3 weeks to impact acne, but most people notice significant improvement in acne after optimizing sleep long-term. Sleep is one of the most underrated acne management strategies. While topical treatments and professional treatments receive most attention, sleep optimization often provides dramatic acne improvement that rivals pharmaceutical treatments. Prioritizing sleep is one of the highest impact acne management strategies available. Guide 35, Water Quality, Hydration Science, and Optimal Water Intake for Clear Skin. While "drink water for clear skin" is commonly repeated, the mechanisms behind water's role in skin health and the specific amount of water actually needed for acne improvement are often misunderstood. Understanding water science and optimal hydration supports acne management. The myth that specific water quantities, 8 glasses daily, etc., directly treat acne is oversimplified. While adequate hydration supports overall health and skin function, consuming excessive water beyond your actual hydration needs doesn't further improve acne. However, maintaining proper hydration throughout the day supports skin health in multiple ways. Dehydration compromises skin barrier function. When your body is dehydrated, your skin compensates by producing more sebum to maintain oil barrier protection. Paradoxically, dehydrated acne-prone skin often appears oily while being dehydrated internally, creating conditions promoting acne. Proper hydration reduces this compensatory sebum production. Hydration supports skin cell function. Skin cells require water to function optimally. Proper hydration maintains cellular processes, supports detoxification, and promotes overall skin health. Dehydrated skin appears duller and is more prone to irritation and breakouts. Hydration supports immune function. Adequate hydration maintains lymphatic function and immune cell circulation, supporting your body's ability to fight acne-causing bacteria. Dehydration compromises immune function, potentially worsening acne. Hydration supports blood circulation. Well-hydrated blood flows more efficiently, delivering nutrients and oxygen to skin cells. Dehydration compromises circulation, reducing nutrient delivery to skin. Optimal daily water intake varies based on body weight, activity level, climate, and individual factors. A general guideline is 35 milliliters per kilogram of body weight daily. For a 70 kilograms person, this equals approximately 2.5 liters, about 10 glasses, daily. However, individual needs vary significantly. Thirst is a reasonable indicator of hydration needs. Drinking when thirsty and monitoring urine color. Pale yellow indicates adequate hydration, dark yellow suggests dehydration, guides appropriate intake. Individual variation in optimal water intake is substantial. Some people need 2 liters daily for optimal hydration, while others need 3 to 4 liters depending on activity and climate. Rather than following a rigid 8 glasses recommendation, assess your personal hydration status and drink accordingly. Water intake timing matters somewhat. Distributing water intake throughout the day maintains consistent hydration better than consuming large amounts at once. However, excessive water intake shortly before bed disrupts sleep through nighttime urination. Tapers off water intake 2 to 3 hours before bed to optimize sleep quality. Electrolyte balance matters for hydration beyond pure water intake. Excessive water intake without sufficient electrolyte intake, sodium, potassium, magnesium, can disrupt electrolyte balance, causing problems. Consuming electrolyte-containing beverages or foods alongside water maintains balance. However, the Western diet typically contains adequate sodium, so electrolyte concerns are minimal for most people unless they're exercising extensively or sweating significantly. Water quality affects skin and acne through multiple mechanisms. Hard water, high mineral content, leaves mineral buildup on skin, potentially irritating it and compromising cleansing efficacy. Soft water cleanses more effectively. If you have very hard water, installing a water softener or using a shower filter might help. However, evidence for hard water directly worsening acne is limited. Chlorinated water can irritate acne-prone skin. Chlorine is drying and potentially irritating. Using filtered water for cleansing if you have highly chlorinated tap water might help. However, most chlorine in tap water is minimal and unlikely to significantly impact acne. Hot water is more drying to skin than lukewarm or cool water. Cleansing with lukewarm water rather than hot water reduces water-related dryness, particularly important for acne-prone skin already potentially compromised by active treatments. Distilled water versus tap water has minimal practical difference for skin health. Distilled water is free of minerals and chlorine but also lacks beneficial minerals, bacteria and irritants to skin, worsening acne. Clean makeup brushes at least weekly with gentle shampoo or brush cleaner. Replace sponges frequently. Use clean hands or clean applicators when possible rather than dirty brushes. Removal of makeup is crucial. Leaving makeup on overnight allows prolonged contact with pores, promotes bacterial growth, and worsens acne. Thoroughly remove all makeup before bed using an appropriate makeup remover or cleansing oil, followed by your regular cleanser. Double cleansing, first with oil-based remover, then water-based cleanser, is particularly effective for completely removing makeup and sebum. Mineral makeup is often better tolerated by acne-prone skin than conventional makeup. Mineral formulations use zinc oxide, titanium dioxide, and iron oxides as pigments without some of the potentially problematic ingredients in conventional cosmetics. Many mineral makeup lines specifically formulate for acne-prone skin. BB creams and CC creams offer lighter coverage than full foundation while providing some color correction. These lighter formulations are often better tolerated by acne-prone skin than traditional foundations. If you need coverage, consider whether a BB cream provides adequate coverage before resorting to heavier foundation. Tinted moisturizers combine light coverage with hydration, often with less pore clogging potential than foundations. For those with mild acne or seeking light coverage, tinted moisturizers can be a good option. Sunscreen itself should be acne-safe. Many sunscreens worsen acne due to occlusive or comedogenic formulations. Specifically choose sunscreens for acne-prone skin, labeled non-comedogenic, oil-free, or for acne-prone skin. Mineral sunscreens are often better tolerated than chemical sunscreens. Testing new products carefully is essential. Introduce one new cosmetic at a time, using it for 1 to 2 weeks to assess whether it triggers new breakouts. If breakouts appear, discontinue the product and wait for acne to resolve before trying a different product. Testing one product at a time allows you to identify which products your skin tolerates. Some people find that minimizing overall makeup use helps control acne more than finding the perfect acne-safe products. If you use makeup only when necessary rather than daily, less product contact with skin means fewer breakout triggers. Consider whether you actually need all the makeup you're using or whether you could achieve similar results with less product. Professional makeup application services for special events often use heavy product application techniques. If you need professional makeup done, inform the makeup artist about your acne and request lighter application and acne-safe products if possible. Alternatively, request that you apply your own makeup at home after a professional provides guidance. The bottom line: find acne-safe products suitable for your skin, apply minimally, remove thoroughly, and use clean tools. This approach allows you to use cosmetics without significantly exacerbating acne. Guide 30. Building your perfect personalized skincare routine. Complete advanced framework. After understanding numerous acne treatments and supporting strategies, integrating all this knowledge into a personalized, optimized skincare routine that works specifically for your skin is essential. This comprehensive framework guides you through creating your perfect routine. Step 1. Identify your specific acne profile. Are you primarily comedonal, blackheads, whiteheads? Inflammatory, red pimples, pustules? Hormonal, deep cystic lesions? Severe mixed type? Fungal acne? Acne cosmetica? Your acne type guides which treatments are most appropriate. Comedonal acne particularly benefits from salicylic acid. Inflammatory acne responds best to benzoyl peroxide. Hormonal acne often requires systemic hormonal treatment. Fungal acne requires antifungal treatments. Getting your acne type right prevents wasting time on ineffective treatments. Step 2. Assess your skin type and sensitivities. Is your skin oily, dry, combination, or balanced? Very sensitive or robust? Do you have history of allergic reactions? Do you have rosacea or other reactive conditions? This information determines which products and concentrations your skin tolerates. Sensitive skin requires gentler products, lower active ingredient concentrations, and slower introduction of new treatments. Oily skin tolerates stronger treatments and higher concentrations. Dry skin requires careful moisturizing even while using drying treatments. Step 3. Evaluate contributing factors. What worsens your acne? Stress? Hormonal cycles? Certain foods? Sleep deprivation? Specific products? Environmental factors? Identifying contributing factors allows you to address root causes alongside medical treatment. If stress worsens acne, stress management becomes part of your treatment. If hormonal cycles worsen acne, tracking cycles and timing treatment adjustments helps. Step 4. Set realistic timelines and goals. Most acne improves over 8 to 12 weeks of consistent treatment. Severe acne might take 4 to 6 months or longer. Scars fade over 6 to 12 months with appropriate treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Your goal might be clear skin or manageable acne with occasional breakouts, depending on your acne severity. Step 5. Design your morning routine. Start with a gentle cleanser appropriate for your skin type, used with lukewarm water. Follow with optional essences or hydrating toners if desired. Apply any morning actives, perhaps vitamin C serum for antioxidant protection. Apply your morning moisturizer. Finish with SPF 30+ sunscreen. This entire routine should take 5 to 10 minutes. Keep it simple so it's sustainable. Step 6. Design your evening routine. Start with makeup removal if applicable, oil-based cleanser or micellar water. Follow with your evening cleanser. Apply any evening hydrating toners or essences. Apply your primary acne treatment, perhaps salicylic acid or benzoyl peroxide, starting at low frequency, typically 2 to 3 times weekly. After allowing this to dry, wait 10 to 20 minutes, apply your moisturizer. If using retinoids, apply them now, after at least 2 to 3 weeks of tolerance building. Optional, apply occlusive oil or balm as final step if your skin is dry. Step 7. Plan your treatment introduction sequence. Never introduce multiple new treatments simultaneously. Introduce your first active treatment, perhaps salicylic acid, use it 2 to 3 times weekly for 3 to 4 weeks, then reassess. If tolerating well and seeing some improvement, after 4 weeks consider introducing a second active, perhaps benzoyl peroxide on different days/times. Build your routine gradually over 8 to 12 weeks. This patience is rewarded with better long-term results than aggressive starting. Step 8. Plan adjustments based on response. After 8 to 12 weeks of consistent treatment, reassess. Is acne improving? Are side effects manageable? Do you need to increase treatment intensity? Based on your assessment, you might increase frequency of treatments, increase concentration, add another treatment, or make other adjustments. However, only adjust one variable at a time so you know what caused any changes. Step 9. Incorporate lifestyle factors. Alongside your skincare routine, implement dietary changes, reduce sugar, increase antioxidants, perhaps reduce dairy. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, exercise, or your preferred method. These factors take 4 to 8 weeks to show skin effects but provide significant benefits. Step 10. Plan professional treatments if appropriate. If after 12 weeks of diligent home care your acne hasn't adequately improved, consider professional treatments like chemical peels, laser, or blue light therapy. Monthly professional treatments combined with home care often produce better results than home care alone for moderate to severe acne. Step 11. Plan long-term maintenance. Once your acne clears, identify which treatments were essential for your success and continue them at maintenance levels. Your maintenance routine might be simpler than your treatment routine, perhaps just retinoid at night and sunscreen during the day, but it should continue indefinitely to prevent acne recurrence. Step 12. Build flexibility for adjustments. Your perfect routine isn't static. Seasonal changes, life stress changes, hormonal cycles, and other factors might necessitate routine adjustments. Have a plan for intensifying treatment during high-risk times, increased stress, menstrual cycle high-risk phase. Be willing to adjust your routine based on your skin's response rather than rigidly sticking to something not working. A sample personalized routine for moderate inflammatory acne might look like: morning, gentle cleanser niacinamide serum, optional, lightweight moisturizer SPF 30+ sunscreen. Evening, makeup removal if applicable, gentle cleanser hydrating toner/essence, optional, benzoyl peroxide 2.5%, 3 to 4 times weekly initially, moisturizer optional, retinoid, starting 2 to 3 times weekly after tolerance built. Lifestyle, 7 to 9 hours sleep, 30 minutes exercise 5 times weekly, stress management, diet emphasizing whole foods with reduced sugar. Professional, monthly superficial chemical peels if available. Timeline, 8 to 12 weeks for significant improvement, 6 months for near-complete clarity. This framework is meant as guidance, not prescription. Your perfect routine will be unique to your specific acne type, skin characteristics, lifestyle, and preferences. The principle is starting conservatively, progressing gradually, incorporating evidence-based treatments, addressing lifestyle factors, and maintaining long-term consistency. This approach works because it respects your individual skin while following scientific principles of acne treatment. Remember, there's no single, best, acne treatment. There's only the best treatment for your individual skin. Finding that treatment requires some experimentation, patience, and willingness to adjust based on results. Most acne responds to consistent, appropriate treatment. Your clear skin is achievable with the right approach for you specifically. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties leads to clear, healthy skin. Your acne journey is unique, but clear skin is absolutely achievable. #20 Level Skin Care and Acne Treatment Guides, Part 3. Each guide, 10 to 15 minutes reading time. Guide 31, Acne Scar Treatments, Comprehensive Guide to All Scar Types and Advanced Therapy Options. Acne scars represent permanent reminders of severe acne, but modern dermatology offers numerous treatment options that can significantly improve scarring. Understanding different scar types, appropriate treatments, realistic outcomes, and combination approaches enables you to effectively address post-acne scarring. Acne scars exist in 3 primary morphologies, each requiring different treatment approaches. Ice pick scars are deep, narrow indentations resembling puncture wounds from an ice pick. These scars have sharp edges and typically measure 1 to 4 mm in diameter but penetrate deeply into the dermis. Ice pick scars are difficult to treat because their narrow base makes many standard treatments ineffective. Boxcar scars are wider depressions with relatively flat bottoms and sharp, vertical edges. These scars typically measure 4 to 6 mm or larger in diameter. Boxcar scars appear similar to chickenpox scars. Rolling scars are shallow depressions with sloping, rounded edges creating a wave-like appearance across the skin. Rolling scars often appear worse when skin is stretched due to their tethered nature. Understanding scar depth and type guides treatment selection. Shallow scars are often more responsive to surface treatments, while deep scars require deeper penetrating treatments. Mixed scar types within the same individual require combination approaches. Prevention remains the gold standard scar treatment. Avoiding picking, squeezing, or extracting acne prevents scarring. Treating acne aggressively to minimize deep inflammation prevents scarring. For anyone prone to severe acne, considering isotretinoin to prevent scarring is appropriate if acne is severe enough to cause scarring risk. For existing scars, numerous treatments provide varying degrees of improvement. Topical treatments are largely ineffective for true scarring, as scarring involves structural collagen loss that topical products cannot reverse. However, treating associated hyperpigmentation with topical treatments makes scars less noticeable. Subcision is a minor surgical procedure particularly effective for rolling and tethered scars. A needle or small scalpel is inserted under the scar, severing fibrous tissue anchoring the scar to deeper structures. This allows the scar to elevate as new collagen forms underneath. Subcision often requires multiple treatments performed weeks apart. Results develop over months as new collagen remodels. Subcision combined with other treatments, fillers, microneedling, often provides better results than subcision alone. Microneedling creates controlled microinjuries triggering collagen production and remodeling. The skin's healing response generates new collagen, improving scar appearance. Multiple treatments, typically 3 to 6 sessions spaced 4 to 6 weeks apart, provide progressive improvement. Microneedling works for all scar types but is particularly effective for rolling and moderate boxcar scars. Post-treatment appearance includes temporary redness and microcrusting. Recovery takes 3 to 5 days for most people. Microneedling is relatively affordable compared to laser treatments and is increasingly popular for scar treatment. Radiofrequency microneedling combines microneedling with radiofrequency energy for enhanced collagen stimulation. This provides better results than standard microneedling but with more significant post-treatment appearance changes and potential side effects. Laser resurfacing removes thin layers of skin, smoothing scars and promoting collagen remodeling. Fractional laser resurfacing treats portions of skin, leaving untreated bridges for faster healing and less downtime than full resurfacing. CO2 fractional lasers are highly effective for acne scars. Multiple treatments, typically 4 to 6 sessions spaced 4 to 6 weeks apart, provide progressive improvement. Post-treatment appearance includes significant redness lasting several weeks and potential for whitening, hypopigmentation. Cost is substantial, $500 to $1,500 per treatment, but results are often dramatic. 𝑦𝒂𝒄𝒊𝒂𝒍 fractional lasers are slightly less aggressive than CO2 lasers, with somewhat less downtime and slightly less dramatic results. For those seeking good results with less recovery time, 𝑭𝒂𝒄𝒊𝒂𝒍 is a reasonable option. Chemical peels remove skin layers through acid application. Superficial peels with glycolic or salicylic acid remove only the superficial layer and provide minimal scar improvement. Medium-depth peels with TCA, trichloroacetic acid, penetrate deeper, removing epidermis and superficial dermis, providing better scar improvement. Medium peels require 5 to 7 days of peeling and recovery. Deep peels with phenol or high-concentration TCA penetrate most deeply but require significant recovery time and carry higher complication risks. Deep peels are rarely used for acne scars specifically, being reserved for severe aging or other conditions. Dermal fillers inject material beneath scars to elevate depressed scars temporarily. Different fillers last different durations. Hyaluronic acid fillers typically last 6 to 12 months, while longer-lasting fillers, calcium hydroxylapatite, polyl-lactic acid, last 12 to 24 months. Filler results are immediate, making this attractive for short-term improvement. However, repeated treatments are necessary to maintain results. Fillers work particularly well for ice pick and boxcar scars. Platelet-rich plasma, PRP, therapy uses concentrated growth factors from your own blood to stimulate collagen production and healing. PRP is injected into scarred areas, promoting new collagen formation. Multiple treatments are typically needed. While PRP is popular, evidence for its efficacy in acne scar treatment is mixed, and it's more commonly used as a supplement to other treatments rather than as monotherapy. Combination approaches yield best results for acne scarring. A typical combination might include subcision for tethered scars, followed by microneedling for collagen stimulation, combined with fractional laser for surface smoothing and additional collagen remodeling. This multimodal approach addresses different aspects of scarring simultaneously. Treatment planning requires professional expertise. Severe, extensive scarring warrants referral to specialized dermatologists experienced in scar revision. Your dermatologist can assess your specific scars and recommend appropriate treatments. Realistic expectations are essential. Most scars improve significantly, 50 to 75%, but are rarely completely eliminated. Severe, deep scarring might only achieve 30 to 40% improvement even with aggressive treatment. However, significant improvement is usually achievable and worthwhile. Timeline for scar improvement is measured in months and years, not weeks. After a laser treatment providing immediate dramatic improvement, additional improvement occurs over 3 to 6 months as collagen remodels. Multiple sequential treatments provide cumulative improvement over 6 to 12 months or longer. Cost is a consideration. Professional scar treatments are expensive, laser treatments $500 to $1,500 per session, multiple sessions required.